Good morning, everyone. I want to start with a question that I ask my patients nearly every single day in my clinic. Are you tired? Are you stressed? Do you find yourself reaching for another cup of coffee just to get through the afternoon? And more importantly, have you checked your blood pressure lately? Because here's what I've learned after 23 years of practicing medicine. Most of my patients with high blood pressure didn't wake up one day and decide to develop hypertension. It crept up on them slowly, quietly, like an unwanted guest who arrived years ago and simply never left. And what shocked me most as I progressed in my career was discovering that many of these patients, even those on multiple medications, could have made a significant difference in their condition with something so simple, so elegant, and so completely free: their own breath. You see, when I was in medical school, we spent weeks on cardiovascular pharmacology. We learned about ACE inhibitors and beta blockers and calcium channel blockers. We memorized drug interactions and side effects. But nobody, and I mean nobody, gave us a single lecture about the power of controlled breathing to lower blood pressure. It wasn't until I started seeing my patients actually implement breathing techniques that I understood how foolish this gap in our education was. Today, I want to share with you 3 specific breathing techniques that have transformed the lives of countless patients I've seen walk through my office doors, and I want you to understand not just how to do them, but why they work so powerfully in your body. Let me paint you a picture of what happens when your blood pressure spikes. Your sympathetic nervous system, what we call your fight or flight response, kicks into high gear. Your heart rate increases, your blood vessels constrict, and stress hormones like cortisol and adrenaline flood your bloodstream. This is wonderful when you're actually running from danger, but the problem in our modern world is that this response gets triggered by emails, traffic jams, and financial worries. We live in a constant state of low-level activation, which means our blood pressure stays perpetually elevated. This is where breathing techniques become absolutely revolutionary, because here's the beautiful truth. When you engage in deliberate, controlled breathing, you activate your parasympathetic nervous system, which is essentially your relaxation response. You're essentially telling your body that the danger has passed, that it's safe to calm down. Now, the first technique I want to teach you is called box breathing, and it's so effective that it's used by Navy SEALs, police officers, and other professionals who need to maintain calm under extreme pressure. The technique is beautifully simple, and that's precisely why it works so well. You're going to breathe in for a count of 4, hold your breath for a count of 4, exhale for a count of 4, and hold empty for a count of 4. That's one complete cycle. Most of my patients do 5 to 10 cycles, usually spending about 4 to 5 minutes on the technique. What I love about box breathing is that the mathematical symmetry actually helps your mind stay focused. You're not thinking about your deadline or your argument with your spouse. You're thinking about the numbers, about the balance, about the rhythm. Let me tell you about Margaret, a 62-year-old patient of mine who came in with a blood pressure reading of 158/92. She was terrified. Her mother had died of a stroke at 65, and she felt like she was hurtling toward the same fate. I immediately started her on a low-dose antihypertensive medication, but before she left my office, I spent 10 minutes teaching her box breathing. I told her to practice it 3 times daily, once in the morning, once at lunch, and once in the evening. I also told her to use it anytime she felt stress rising. 6 weeks later, when she came back for her follow-up appointment, her blood pressure had dropped to 138/85. That's a significant improvement, especially considering we hadn't even adjusted her medication. Her eyes lit up when I told her that her diligent practice of this breathing technique was doing meaningful work in her body. What happens physiologically during box breathing is quite remarkable. The equal intervals activate something called baroreceptor reflex. These are specialized nerve endings in your arteries that sense blood pressure changes. When you deliberately slow your breathing, you're essentially sending a signal to these baroreceptors that everything is under control. This triggers a cascade of responses. Your heart rate slows down, your blood vessels relax, and your overall vascular resistance decreases. Blood pressure is essentially a function of how hard your heart is pumping and how much resistance is in your blood vessels. When both of these factors decrease, your blood pressure drops. And here's what really excites me as a physician. This effect is cumulative. Each time you practice box breathing, you're training your nervous system. With consistent practice over weeks and months, your baseline blood pressure actually decreases even outside of these practice sessions. Now let's move to the second technique, and this one has a beautiful Sanskrit name, Nadi Shodhana, or alternate nostril breathing. This technique has been part of yogic traditions for thousands of years, and modern neuroscience has finally caught up to validate what ancient practitioners knew intuitively. The technique works like this. You're going to close your right nostril with your right thumb and breathe in through your left nostril. Then you're going to close your left nostril and exhale through your right nostril. Then you're going to breathe in through your right nostril, close it, and exhale through your left. That's one complete cycle. I typically recommend 12 to 20 cycles, which usually takes about 5 to 10 minutes. The mechanism behind why this works is genuinely fascinating. Your two nostrils are actually connected to different sides of your brain and different aspects of your nervous system. Your right nostril connects more to your sympathetic nervous system, that arousal and activation side. Your left nostril connects more to your parasympathetic nervous system, the relaxation and digestion side. Now, you might be thinking, this sounds too esoteric, too abstract. But here's where the science comes in. Studies using thermal imaging have actually shown that when you close one nostril, the airflow through the other increases, which affects the temperature and pressure in different parts of your nasal cavity, which sends different signals to your brain. By alternating between nostrils, you're essentially balancing these two systems, bringing them into equilibrium. I had a patient named David, a 48-year-old accountant who was absolutely skeptical about all of this. He came to see me with a blood pressure of 151/88 and absolutely no interest in meditation or yoga or anything remotely spiritual. He was a data guy. He wanted medications, he wanted science, he wanted results. So I sat down with him and I showed him the research studies. I showed him a study published in a reputable cardiovascular journal that demonstrated a 6 mm mercury drop in both systolic and diastolic blood pressure after just 8 weeks of alternate nostril breathing. Once I presented it that way, he was willing to try. 3 months later, he came back with a blood pressure of 136/82, down from his starting point of 151/88. He'd been practicing alternate nostril breathing every single evening for 10 minutes before bed. He actually admitted to me that he'd become almost meditative about it. It had become his transition time between the stress of work and the peace of his evening. What I tell my patients is that alternate nostril breathing is particularly powerful for people who struggle with anxiety-related hypertension. Many of my patients don't just have physically elevated blood pressure. They have psychosomatic elevation caused by chronic stress and worry. This technique addresses that directly. By balancing your nervous system, you're reducing the background noise of anxiety that's constantly driving your blood pressure up. And unlike medications, which work on your cardiovascular system directly, this technique is working on your nervous system, on your stress response, on your emotional state. This is preventive medicine at its finest. Now, let me introduce the third technique, and this one is particularly powerful. It's called the extended exhale breathing, or what some people call 4-7-8 breathing, though I prefer a slightly different ratio. The basic principle is that your exhale should be longer than your inhale. This is absolutely crucial. When you exhale, you stimulate your vagus nerve, which is like the main highway of your parasympathetic nervous system. The longer your exhale, the more you stimulate this nerve, and the more powerfully you activate your relaxation response. A simple pattern I recommend is breathing in for a count of 4 and exhaling for a count of 6 or 7. You can work up to inhaling for 5 and exhaling for 8, or even inhaling for 4 and exhaling for 8. Some of my patients eventually work up to very long exhales of 10 or even 12 counts. Let me explain the neuroscience here. Your heart rate naturally slows down during your exhale. It speeds up slightly during your inhale. This is called heart rate variability, and it's actually a marker of good cardiovascular health. When you deliberately extend your exhale, you're prolonging that phase of your cardiac cycle where your parasympathetic nervous system is active. where you're building more relaxation response into your physiology. With consistent practice, this actually changes your heart's baseline functioning. Your resting heart rate decreases and your overall cardiovascular efficiency improves. I remember treating a patient named Susan who was referred to me by her cardiologist because she had developed what we call labile hypertension. Her blood pressure would spike dramatically in response to minor stressors. She'd go from 130/80 to 160/95 in just a few minutes if she got frustrated. This pattern is actually quite harmful because it stresses the arterial walls and increases cardiovascular risk. When I taught her extended exhale breathing, I suggested she practice it for 5 minutes every morning and another 5 minutes in the evening. But more importantly, I told her to use it as her immediate response tool whenever she felt her blood pressure rising. If she felt frustration coming on, she'd immediately shift to extended exhale breathing. Within weeks, those dramatic spikes were significantly reduced. Her baseline blood pressure dropped, and more importantly, her blood pressure variability decreased, meaning she wasn't experiencing those dangerous peaks anymore. Here's what I always emphasize to my patients, and I want to emphasize it to you as well. These breathing techniques are not meant to replace medical treatment for severe hypertension. If you have a blood pressure reading of 160/100 or higher, you absolutely need medication, and you need to work with your doctor. But what these techniques do is they provide a complementary approach that can reduce your medication burden over time, improve your overall cardiovascular health, and most importantly, they give you active agency in managing your own health. Instead of feeling like a passive recipient of medication side effects, you're actively participating in your healing. The consistency with which you practice these techniques is absolutely critical. This is where most people fail, not because the techniques don't work, but because they don't stick with them. My patients who see the best results are those who integrate these breathing practices into their daily routine. They practice in the morning while they're still in bed. They practice during their lunch break. They practice in the evening before dinner. They practice whenever they feel stress rising. It becomes as automatic as brushing their teeth. And what's remarkable is that usually after about 4 to 6 weeks of consistent practice, the benefits become noticeable. After 3 to 4 months, the changes are substantial. Let me share with you the research that supports what I'm telling you. Multiple peer-reviewed studies have shown that regular breathing exercises can reduce blood pressure by 5 to 10 millimeters of mercury on average. That might not sound like much, but cardiovascular researchers know that every 2 millimeter reduction in systolic blood pressure reduces the risk of cardiovascular disease and death by about 4%. So a 5 to 10 millimeter reduction is actually clinically significant. Some studies have shown even more dramatic results, with reductions of 15 to 20 millimeters of mercury in regular practitioners. What I tell my patients is to approach this with a sense of curiosity and gentle persistence. Pick one technique and commit to practicing it for at least 2 weeks. Notice what happens. Notice how you feel. Notice any changes in your blood pressure. If you use a home blood pressure monitor, track your readings. Then, if you'd like, add a second technique. Some of my patients love box breathing and practice it almost religiously. Others absolutely resonate with alternate nostril breathing and feel the difference immediately. Others prefer extended exhale breathing. The beautiful truth is that they all work, so your job is simply to find the one that resonates most deeply with you and then commit to it. I also want to mention something about the mind-body connection that's absolutely critical. When you're practicing these breathing techniques, you're not just working on your physiology. You're sending a powerful psychological message to yourself, a message that says, I am in control, I can calm myself, I can manage my health. This cognitive shift is tremendously powerful. Many of my patients report that as they continue practicing these techniques, they develop a different relationship with stress itself. It doesn't eliminate stress from their lives, but it changes how their bodies respond to stress. They feel more resilient, more capable, more empowered. Let me give you one more example because I think these real-world applications really illustrate how powerful this is. I had a patient named Robert who was a trial lawyer, an incredibly high-stress profession. His blood pressure was 155/90, and he was essentially living on beta blockers. When I introduced him to box breathing, he started practicing it before important trials. He would spend 4 minutes doing box breathing in the bathroom before walking into the courtroom. His blood pressure during those stressful events was noticeably lower, his anxiety was reduced, and interestingly, his colleagues actually commented that he seemed calmer and more focused. He eventually became so proficient at these techniques that he could drop his blood pressure medication dose by half under his physician's supervision, while maintaining better blood pressure control than he'd ever had on the full dose. Now, I want to talk about something that's equally important as the techniques themselves: the practice environment and consistency. When you're learning these techniques, try to practice in a quiet, comfortable space. It doesn't have to be elaborate. It can be your bedroom, your office during lunch break, even your car parked in a quiet lot. The key is that you're removing distractions and creating a space where you can focus on your breathing. As you become more proficient, you'll be able to practice these techniques anywhere, on a crowded train, during a stressful meeting, in a traffic jam. But when you're learning, give yourself the gift of a peaceful environment. Many of my patients also find it helpful to practice these techniques at the same time each day. Your body is incredibly adaptive, and it will actually begin to anticipate these practice sessions. Your nervous system will start priming itself for relaxation as you approach your usual practice time. This is classical conditioning, and it makes the techniques even more effective over time. I also want to address something I hear from many patients. They say, "Doctor, I feel ridiculous breathing like this. It feels fake. It doesn't feel natural." And here's what I tell them: of course it doesn't feel natural. You're retraining your nervous system. Your baseline right now is elevated stress, and you're learning to shift toward relaxation. This is new territory for your body. It takes time to feel natural. But here's what happens. Usually after about a week or two of consistent practice, patients report that the breathing starts feeling automatic. They start to anticipate it. They actually notice when they miss a day because they feel less calm. Their body begins to crave this practice. This is exactly what you want to happen. Let me also touch on the dietary and lifestyle factors that work synergistically with these breathing techniques. The research is very clear. If you're practicing breathing exercises but you're still eating a high-sodium diet, you're working against yourself. If you're practicing breathing exercises but you're sedentary, you're missing an opportunity. The most effective approach combines breathing techniques with dietary modifications, reducing sodium intake, increasing potassium through foods like bananas and sweet potatoes, limiting alcohol, managing caffeine intake, combined with regular physical activity. Most studies show that even gentle physical activity, like 20 to 30 minutes of walking 5 days a week, combined with breathing exercises, produces remarkable results. I also want to mention meditation, because while meditation is not strictly a breathing technique, it often naturally emerges from practicing these breathing techniques. Many of my patients find that as they practice box breathing or alternate nostril breathing consistently, they naturally begin to notice other thoughts, other sensations in their body. They become more aware. This growing awareness is actually incredibly valuable for blood pressure management because it helps you catch stress and anxiety earlier, before it has a chance to spike your blood pressure. Meditation is like the advanced class in this practice. It's not necessary, but it's wonderful if it develops naturally. Here's something else that's critical, and I think many healthcare providers don't emphasize this enough. When you start practicing these techniques and your blood pressure begins to improve, you need to communicate that to your doctor. If you're on blood pressure medication and your blood pressure starts dropping, your medication might need to be adjusted. You don't want your blood pressure to drop too low. That's actually dangerous. This is another reason why these techniques should be used in partnership with your healthcare provider, not instead of professional medical care. Let me also address a question I get very frequently. People ask, how long do I need to keep doing this? Will the benefits persist if I stop? The answer is nuanced. The benefits do have some permanence. You've essentially trained your nervous system to be more responsive to relaxation cues. But blood pressure is dynamic. It responds to your current stress level, your diet, your activity level, and yes, your breathing practices. Most of my patients find that maintaining these practices even at a reduced frequency perhaps 3 to 4 times a week instead of daily, keeps them in that optimal range. The goal is to incorporate these into your life in a way that feels sustainable, not as another obligation. I'm genuinely passionate about sharing this information because I've witnessed so many transformations. I've watched people come in defeated, believing they were destined to be medication dependent for the rest of their lives, only to discover that they had the power within their own breath to change their health trajectory. This isn't magic, and it's not oversimplification. This is solid neuroscience and physiology. This is evidence-based practice. This is your body's own pharmacy, and you've had access to it your entire life. You just didn't know how to tap into it. So my challenge to you is this. Pick one of these 3 techniques: box breathing, alternate nostril breathing, or extended exhale breathing. Commit to practicing it daily for 2 weeks. That's all I'm asking. 14 days of dedication to your own health. Don't do it because you think you have to. Do it with curiosity. Do it with the mindset that you're conducting an experiment on yourself. Notice what happens. Notice how you feel. Track your blood pressure if you can, and then come back and share what you experienced. If you've found this information valuable, I truly hope you'll subscribe to this channel. Subscribe because I share evidence-based medical information that can genuinely transform your health. Subscribe because I believe you deserve to understand your own body, to have agency in your own health decisions. Subscribe because there's so much more I want to share with you about managing chronic conditions naturally, about preventive medicine, about taking your health back into your own hands. And please, leave a comment below. Tell me which breathing technique resonates most with you. Tell me if you've tried any of these before. Tell me about your experiences with blood pressure management. Tell me what health topics you'd like me to address in future videos. Your comments help me understand what matters most to you, and they help other viewers see that they're not alone in their health journey. We're building a community here of people who are taking their health seriously, who are curious, who are willing to try new approaches. That's powerful. That's how we create real change. Thank you for watching, and I'll see you in the next video.